because your case matters. WKFirm.com.
Well, as you know, Friday was Go Red Day for Women's Heart Health. That was just to get your attention. And today we have an Ask the Doctor segment all about heart disease in women. And I'm joined by Anuradha Rao. She is a cardiologist at Cardiovascular Associates, and we're ready to take your calls. Here's that number, 741-9272. And Anu, we know that heart disease presents differently in women. Very quickly, what are the things that women specifically need to watch out for?
So when we think about heart disease and heart attacks, we always think about chest pain or chest pressure, which women can have, but they can also have unusual symptoms, so just indigestion, or just perhaps their shoulder or their jaw. It can be just shortness of breath or a profound fatigue. So something that's just a profound change in their well-being should be taken seriously.
Need to be aware of that.
Absolutely. It does not have to be the worst chest pain you've ever had.
We've got a question right now from our viewer, Laura. Laura, what is your question?
My question is, should I be alarmed for started with my left arm hurting real bad, and I be shortness of breath, and my heart started racing, and it sounds like it's just beating real fast. Should I be alarmed because I've been diagnosed with congestive heart failure?
So, Laura, it sounds like you've already been seeing a cardiologist.
Yes,
and so if these are new symptoms, you should definitely let your cardiologist know about that so they can check them out. When you're having discomfort in your arm, it can, of course, be your heart. It can be other things, but you always want to make sure your heart is okay. When your heart is racing, that can be a sign of irregular heart rhythm, so you want to make sure you don't have anything like that going on. So definitely give your cardiologist's office a call and let them know that you have these new symptoms.
Because I suffer with blood clots as well.
Yeah, and so you have a few different serious issues there, and so you don't want to just be at home wondering if these are issues. You definitely want to be communicating with your cardiologist.
And one thing, women tend to explain it away, right?
Yes.
And we shouldn't explain it away, so check with your doctor right away, Laura.
Yeah.
Virginia is our next caller. Virginia, what's your question?
Yes, I was wondering about, I had a heart attack in my memory.
So you're wondering if the heart attack caused memory issues?
Yes, ma'am. Memory issues.
So memory is always a tough one because I think all of us, as we get older, our memory is just not the same as it used to be. But, you know, when you have heart disease, it's a sign that you have blood vessel disease. So blood vessels, not only do they supply your heart, but they do supply your brain. So just as you've had hardening of the arteries going to your heart, you very well can have that going to your brain. So it's not unusual to have issues with your memory just by the basis of the disease alone. But you should get with your physician, review your medications, and make sure there's nothing else affecting your memory. That would be where I'd leave it, is with a follow-up visit.
Okay. We have one more caller very quickly if we can. Cindy, your question? Cindy, do we still have...
Yes, I'm here.
What's your question?
I would like you to comment on how diabetes affects the heart, and how careful should you be when exercising when you have diabetes?
So that's a great two-part question you're asking there. So diabetes is very associated with heart disease. Just like the last caller, I was talking about blood vessels affecting all of the body. Diabetes is a significant risk factor for developing blood vessel disease, whether it's supplying your heart, your brain, the blood vessels to your legs. A person who's a diabetic should definitely have aggressive prevention to make sure they don't develop hardening of the arteries. And then with exercise, of course, you need to be guided by your physician, but exercise is always a good thing for your blood sugars. People who exercise regularly who have diabetes tend to have better control of their blood sugars.
All right. Doctor, thanks very much. I'm afraid we're out of time. Dr. Anuradha Rao, thanks for being with us. We appreciate it.